Hi guys, this topic is about pregnancy and birth. Okay, so looking on this is a website, trusted website about pregnancy. This is cdc.gov. Let's look at some of the ideas and issues here. Okay, so with pregnancy, there's a couple things that occur at the beginning to basically that you need to know about even before you get pregnant. So there's something called birth defects where babies can be born and have issues of various kinds, whether like major medical issues. One thing about to prevent things like that is if a woman has folic acid, it prevents a major birth defect. Folic acid is in things like orange juice, it's in women's vitamins, things like that. Smoking during pregnancy can actually cause low birth weight and have issues like that. Alcohol can definitely affect a baby after it's born. If you are pregnant and you drink when you're pregnant, it can cause fetal alcohol syndrome, which has a lot of learning disabilities are associated with it. Marijuana use can harm baby's development as well if you are using marijuana with THC in it. Vaccinations, you kind of need to be vaccinated before you're pregnant a lot of times. And you want to have these vaccinations because it helps protect yourself and it passes to the baby, because there's a certain time at the beginning of a baby's life where they basically don't have any immune system, and what immune system they have is from you. So that's why they recommend women having those vaccinations even before you're pregnant. Infections can cause, talking about in the vaginal area, things like that can actually cause a fetus to die before being born. HIV, that is something that pretty much most people are tested for when you're pregnant. West Nile virus and Zika virus are mosquito-borne infections. Like Zika especially can cause massive birth defects. A baby born with a smaller head and brain. Now, diabetes can actually increase the chance for birth defects and other problems for your baby and cause serious complications for you as well. Same with high blood pressure. Diabetes and high blood pressure are the things that they tend to worry about most when we're talking about a woman being pregnant, because you can become diabetic when you're pregnant. And it tends to, that kind of diabetes is called gestational diabetes, and it happens only when you're pregnant, and once you have the baby, you're no longer diabetic, which is kind of cool for the most part. High blood pressure can be the signs of really bad complications for you if you're pregnant. There are some medications that you would have to stop taking because it can cause birth defects as well. Depression, you need to be aware of. Same with being exposed environmentally as well. So those are some of the things you just kind of have to watch when we're talking pregnancy. Weight gain as well. You have to kind of watch that as well. There's also all sorts of genetic issues that, for the most part, most people do not have issues with. Things to think about. Before the baby arrives, breastfeeding breast milk, what it does is it helps protect the baby against illnesses because it has antibodies that can protect the baby from bacterial and viral infections. They do a lot of newborn screenings because there's some things that if they poke the baby's heel, get some blood, they test for diseases that if they test and find out when they're born and treat, there are no issues, but there are massive issues if that disease is not known. Sudden infant death syndrome does happen. Not that often, but it does happen. And you have to be aware of that. And you have to be aware of having good safety seats. Now talking about the actual pregnancy itself. So there are 3 trimesters of a pregnancy. Each are basically 3 months long. Trimester just means 3 time periods. First 3 months, next 3 months, last 3 months. And there are different things characterized by each one. But once you are in your last trimester, most pregnancies last around 40 weeks, which is actually technically 10 months. But when they officially count someone as pregnant, you can, it is according to a woman's last period, which it doesn't necessarily mean they were pregnant for that entire month, basically. Only part of that. Okay, so with labor, what happens is the baby starts kind of moving lower in the pelvis. It's called lightening. Eventually start having contractions. You don't want these to happen before about 37 weeks. That's called preterm labor. The baby, if born, would be a preemie and have to probably stay in the hospital until usually the about when they would be born, because they have medical issues a lot of times. So contractions are kind of when the whole abdomen, uterus, starts kind of squeezing and contracting. And that causes the baby to slowly be pushed out the vaginal canal. Before a baby is born, usually the water breaks. A baby is in a basically a sac that has fluid in it. When the baby is coming, oftentimes the water breaks before the baby is born, and that is a sign definitely you need to go to the hospital, and because the baby needs to be born usually within about 24 hours of that happening. And that's just kind of the start of it. So there's different stages of labor, but a lot of women get false labor or Braxton Hicks. It is just sort of the thing where the body's just sort of prepping for contractions and labor. Stages of labor. We're going to go through this quickly. Baby's head enters the pelvis facing to one side, then rotate face down. Second stage. Strong contractions. The cervix stretches. Then eventually the last stage, our second stage, involves pushing and delivery. Usually takes 20 minutes to 2 hours. And once the baby's born, well, there's lots of ways babies are born. But in general, the baby's head will crown, you'll push, baby comes out. Afterwards, there is the afterbirth, the placenta also has to be delivered. And that's how that happens. Now, there's different ways to manage labor pain. You can just do breathing exercises, focus. Some people use water because that helps during labor, kind of a bathtub. There's also medical methods like an epidural or opioids, different types of blocks. Sometimes if a woman's been pregnant for a really long time, labor is induced. There's some medicine that can be given to cause birth to happen. Or babies are also born during cesarean or C-section, where they cut through the abdomen to get the baby out through the lower abdomen. Okay, so that's just a very quick summary. Have a nice day.